Hello everybody, this is Gary. Today is January 20th, 2023. It's 10:35 a.m. Eastern Standard Time in the United States in Rochester, New York, and this is my coping with schizophrenia blog entry for today. Today my anxiety levels are very high. I've been diagnosed with pulmonary fibrosis and it's interfering with my breathing. I've been trying to get hold of my primary care provider for the past 2 days to try to get an evaluation of my CAT scan that I had. I don't know if this pulmonary fibrosis is going to shorten my life or not. And my anxiety levels are very high. My fear levels are very high. My depression is very severe. My auditory hallucinations are at a bare minimum. But my paranoia and delusions are getting worse from the stress. I'm very, very agitated, very, very restless. I have difficulty breathing when I go for a walk or when I put extra strain on myself. Even just doing little things like my laundry or cleaning my apartment gets me out of breath. I haven't had a cigarette in 12 months, so I don't know if this is related to the fact that I used to smoke or not. Pulmonary fibrosis is when scar tissue develops in the lungs in the small air sacs. And sometimes the scar tissue can spread depending on what the cause of the pulmonary fibrosis is. So I looked up pulmonary fibrosis online, and for some people, the life expectancy after diagnosis is 3 to 5 years. Some people live longer than that, but I don't know because I haven't been able to get hold of my primary care provider yet. I sent her a message and she hasn't contacted me back. I told her I need to see somebody, anybody, any one of the medical providers they have at my primary care clinic. I need to know what the hell is going on because I don't know what's going on. And it's very frustrating and very aggravating. And my anxiety levels are very, very, very high. And my fear levels are very high. I'm trying to stick to my daily schedule, including my meditation, doing my walking exercises outdoors, which I have not done yet today, but I'm planning to. I did some work on my computer. I did consumer surveys for money. Um, I'm making this video as part of my daily schedule. I'll probably do some meditation in a little while to calm down when I take my new medications, including the Klonopin that I'm allowed to take 0.5 milligram 3 times a day. That helps somewhat, but of course that doesn't treat the problem with my pulmonary fibrosis. So I don't know what's going on, and I'm very, very afraid, very, very scared. It seems like my primary care provider is not taking this seriously enough. I'm very, very, very frustrated, and I just want to know what the hell is going on with my health. My friend Sue had back surgery yesterday. She seems to be doing fine. She called me on Facebook on a video call, and I was able to talk to her. She's in pain, of course, and she has 20 staples down her back, but it seems the surgery went okay for her, and she has a low-grade fever, and she'll be in the hospital for a few days, and I wish her well, and I hope she recovers as quickly as possible. And as far as me, there's nothing else much to report on. I have an appointment next week with my peer support specialist, and after that, I have an appointment with my therapist the week after that, and I'm also seeing my psychiatrist in a few weeks. I doubt we'll make any changes to my medication. But beyond that, there's nothing else to report on. I don't feel well mentally, and I get very, very out of breath physically. Like, comment, share, subscribe.